Hi, I'm Dr. Patrick Flaharty, Medical Director at Azul Cosmetic Surgery and Medical Spa. And today we're going to talk a little bit about surgical facial rejuvenation. You know, nowadays there's so many things we can do to help rejuvenate the face without surgery, and that's been the really exciting thing in the last 10 years is the advent of modern fillers, Botox, new cosmeceuticals and skincare that can really dramatically rejuvenate the face without surgery. That part of cosmetic facial surgery or procedures continues to grow and evolve and will do so for years to come. However, when people get to a certain age, typically in the early 50s, they often find that some of the changes can't be fixed with Botox fillers and skincare alone. Heaviness of the brows, looseness of the skin around the eyelids, some sagging of the mid-face, jowling, and of course neck laxity and looseness of the skin of the neck. These are typically areas that become more visible in the late 40s, 50s, and 60s, and certainly lead to some aging changes, tiredness, loss of that attractive, youthful shape to the face. And when people get to that age, it's typically not one area, but typically all the areas sort of age at a very similar rate for each person. So our practice has really evolved to address all these areas in a single procedure. Nobody loves surgery. People generally aren't excited about surgery, but surgery is often the avenue to the best and longest lasting rejuvenation of the face. And if you can accomplish everything with one procedure, with 1 to 2 weeks of downtime, then you really can turn the clock back 10 to 20 years in a single procedure and never really have to think about coming back to the operating room again. And that's, I think, where we're at in the state-of-the-art facial rejuvenation. So in a single setting, we may do endoscopic brow lifting, very small incisions hidden to lift the forehead. This is done in a closed technique. There isn't a big incision or opening up of anything. These small incisions allow us to put delicate instruments in to release the tissues around the brow and into the midface, and really to slide the scalp up and then hold it into place while it seals down, rejuvenating the upper third of the face. The eyelids would then be addressed next. If there's heaviness of the upper eyelid that is not corrected by the brow lift, then we may take out a little bit of loose skin. Many times it's interesting when we do a brow lift, we've lifted that heavy tissue out of the lid and we don't need to do anything with the upper eyelid. In the lower eyelid, we have to look at the skin tone, the fatty pockets, and the hollowness beneath that area. We may shrink the fat or take out a little fat. We often will tighten the skin to get rid of some of the laxity of the lower eyelid skin. And many times we'll use a long-lasting filler to fill in the hollowness or dark circles under the eye and even into the mid-face to give us some fullness and plumping. This approach has eliminated the need for mid-face lifting in almost all patients, and that's an operation I rarely perform today because rejuvenation of the lower lid and mid-face can be accomplished with minimally invasive tightening and fillers. Then in the lower face and neck, we want to address the laxity to the cheeks, jowls, and neck area. For this area, we do what I call our hidden incision facelift. This is a lift where we hide the incision segmentally in the hair, inside the ear, hidden in the cleft behind the ear and into the hairline again, so there's no visible incision lines. By doing this, we can free up the skin, tighten the deeper layers of the face and neck, and that's where the tension goes, at the deeper layers, not on the skin. And once we've done that rejuvenation to the lower face and neck, and with that, we'll often do a tiny incision here and do some liposuction to thin out the fatty fullness. We all tend to get fat under here, and thinning that out will get rid of that fullness and give us a nice flat contour. Then we do the deeper tightening, and then we remove the extra skin that's been created. It's very important to recognize that good technique centers around rejuvenation of the deeper structures of the face, so that you've really just created extra skin, and by just tapering out that extra skin we get a very natural result with no tension to the skin. This procedure is performed typically in 3 hours or less, and I'm talking about everything at once, and it's done under local anesthesia. We do all of our surgery in a licensed surgical center, and we do have MD anesthesiologist there to oversee your care, so it's the highest level of safety and credentialing. This OR is designed specifically for cosmetic patients, so we have a private room for patients pre- and post-operatively and a very specialized operating room designed specifically for facelift patients. But it's all done under local anesthesia. You don't need to be put under general anesthesia for these procedures anymore. And the procedure is really a series of minor procedures where we do the brow, lids, fillers, neck, lipo, face, and neck in sequence. Because we do this every day and we've gotten very, very good at it, and I've got an excellent team of support staff that know what to do at every minute of every procedure, this moves along very quickly. Typically 3 hours, as I mentioned, is sort of the average for a complete face rejuvenation. Patients are often on their way home prior to noon or 1 o'clock. We typically will see the patient the next day, take a look at all the incision lines, make sure everything looks good. Patients will obviously rest and take it easy for 3 to 4 days. We let you resume a lot of your normal activity really after the first couple of days in terms of walking, very light exercising, certainly activities around the house. And almost everybody is back to full social activity within 1 to 2 weeks. Of course, depending on the patient, the extent of surgery, and how much swelling or discoloration they may have. But the modern era of facial rejuvenation now has really moved towards a single procedure done under local anesthesia with a quick recovery time, which allows us to get a very dramatic and long-lasting rejuvenation in a very safe and effective procedure.